Hi there, my name is Amy and I am a nursing student at Indiana State University, and this is my community health education program. The focus of my community health education program are developmentally disabled adults and children who are a population at risk for abuse, neglect, and exploitation. After this presentation, you will be able to discuss types of developmental and intellectual disabilities, give a definition of abuse, neglect, and exploitation, identify signs and symptoms of abuse, neglect, and financial exploitation, explain why this population is at risk for abuse, neglect, and financial exploitation, and describe the legal responsibility and how to report suspicions of abuse, neglect, and exploitation. Before we begin with the presentation, let's see what you already know. Please follow the link below to take a 10-question pre-test. Developmental and intellectual disabilities are disorders that are usually present at birth and may negatively affect an individual's physical, intellectual, and emotional development. Some causes of developmental and intellectual disabilities may be poor health care or prenatal care, growth or nutritional deficit, extreme prematurity of the infant, drug or alcohol abuse during pregnancy, child abuse or abuse of the mother during pregnancy, a chromosomal or gene abnormality, or a brain injury or infection. A developmental disability can be diagnosed when there's a substantial limitation in 3 or more areas that will continue indefinitely throughout the course of an individual's life. Some of these limitations may be language, mobility, learning, self-care, the capacity for independent living, economic self-sufficiency, and need for self-direction. We will now review definitions of abuse, neglect, and exploitation. Abuse is the infliction of injury, unreasonable confinement, intimidation, or cruel punishment that causes or is likely to cause physical harm, pain, or mental anguish, including sexual abuse. Neglect is a threat to an adult's health or welfare by physical or mental injury or impairment, deprivation of essential needs, or lack of protection from these essential needs. Exploitation is the illegal or improper use of a dependent adult or that adult's resources for another's profit or advantage. The United States Department of Health and Human Services state that 11% of all child abuse victims have a physical, cognitive, or behavioral disability. So let's look at recognizing signs and symptoms of abuse. Broken bones, burns, cuts, internal injuries, marks, bruises, and scars on the individual, or a change in their emotional behavior may be some signs of abuse. Why might abuse occur? Well, caregiver role strain, stress, burnout, single-parent households, or ineffective coping skills of the caregiver. An individual's dependence on others for personal hygiene could make them more vulnerable for sexual abuse. Some individuals with disabilities may live in small group home settings where abuse can be hidden. Individuals with limited communication abilities may find it difficult to report abuse, and those that are nonverbal are seen as easy targets that cannot report abuse. And lastly, those with disabilities may not understand what abuse is or are able to escape from a dangerous situation. The United States Department of Justice reports that 1 in 3 children with a disability are victims of some form of maltreatment. Next, let's recognize signs and symptoms of neglect. An individual that has poor hygiene or is malnourished or underweight can be a sign of neglect. An individual's frequent tardies or absences to school or a program. An individual that steals or begs for money or food. Inadequate clothing such as a jacket during the winter season. Inadequate shelter. And unattended or unmet health or medical needs of an individual. So again, why are we seeing neglect in the developmentally disabled population? Well, typically neglect is unintentional on the parent's behalf, related to limited resources and a financial strain related to their child's medical costs, supplies, medications, or equipment needs. Also, those with disabilities are often isolated and dependent on a small group of caregivers where neglect can go unnoticed. Developmentally disabled parents may also have a childhood history themselves of being abused or neglected. The individual's parents may be suffering from depression or have a drug or alcohol abuse problem. And lastly, often with behavioral disabilities, there will be challenging behaviors associated with that, which may contribute to the caregiver's stress, which in turn makes them be neglectful to them and not wanting to deal with that behavior of the individual. A survey conducted by the Spectrum Institute Disability and Abuse Project state that 31.5% of those with disabilities reported being financially exploited. Let's recognize signs and symptoms of financial exploitation. Withdrawals of significant amounts of cash from banks that are unexplained, forged checks, unpaid bills, an individual that is often isolated, dependence of financial care of an individual's money, and multiple requests by a caregiver for money could be signs of financial exploitation. So why might this occur? Well, predators see individuals with disabilities as weak and vulnerable. Individuals with disabilities are often isolated and dependent on a small group of caregivers where mishandling of money is readily accessible and would go unnoticed. And lastly, statistics indicate that abusers may view individuals with disabilities as less human, less valuable, and not a contributor to society, making the abuser find it easier to exploit, abuse, or neglect them. We will next discuss the responsibilities and duty of reporting suspicions of abuse, neglect, and exploitation of a developmentally disabled adult or child, or really any adult and child for that matter. If you are a caregiver offering a service to a developmentally disabled person suspected of abuse, neglect, or exploitation, you could initially report your findings to your agency supervisor or director, and also the agency staff nurse. Typically there is a RN or LPN staffed that can assess the individual first and then pass on the information to a mandated reporting person. If you are not providing care for the individual, but you do still suspect possible abuse, neglect, or exploitation, you can always contact your local child and adult protection or law enforcement agency. I am from Indiana, so I have put in the video the Indiana law for reporting abuse, neglect, and exploitation, which is, in addition to any other duty to report arising under this article, an individual who has reason to believe that a child is a victim of child abuse or neglect shall make a report to the Department of Child Services or the appropriate law enforcement agency. There's also a Child Abuse Prevention and Treatment Act that prevents children from being abused, include those with disabilities. And there's also a 24-hour hotline, Child Help, at 1-800-4A-CHILD, where you can report or ask questions about reporting abuse. Now that we are done with the presentation, please follow the link below to take the 10-question post test to show me what you've learned. Now that we are at the end of the presentation, you should be aware that the developmentally disabled adults and children are at risk for abuse, neglect, and financial exploitation. Some possible reasons for this is due to caregiver role strain, stress, ineffective coping mechanisms, isolation, and for these individuals being viewed as easy targets by predators because they are weak, vulnerable, and unable to voice abuse, neglect, and exploitation. And most importantly, please do not forget that it is everyone's duty and responsibility to report suspected abuse, neglect, or exploitation immediately. Again, my name is Amy and I am a nursing student at Indiana State University, and thank you for watching my community health education program on developmentally disabled adults and children, a population at risk for abuse, neglect, and exploitation.